Hi, my name is Dr. Lori Cayley. I am a functional medicine practitioner. I help women who have thyroid issues to overcome their thyroid condition so that they can restore their health, experience optimal health, and live happy, vibrant lives. Today, I want to talk to you about what you should know about thyroid conditions. And the first thing that I want to tell you is that you may have a thyroid issue and not know it because there are symptoms that can be very vague in the beginning or can overlap with other things. So let's just talk about the symptoms. The symptoms are weight gain or inability to lose weight despite trying different diets and exercise, fatigue, brain fog, anxiety, depression, infertility, cold hands and feet, hair loss, and there's many other symptoms that can go along with having that's hypothyroidism. So many women don't realize that they have a thyroid condition, but when they first start to think that they might, many go to a doctor and they will do a TSH blood test. And many times this blood test comes back normal. So there are a couple of problems with this. And one is that looking at TSH alone isn't a good way to analyze someone's thyroid function. There are many other hormones, and there are also thyroid antibodies that need to be looked at. So you need a full thyroid panel. And the other issue is that the traditional medical model only takes into consideration what the lab will give as a normal value. So if the lab says your TSH is, higher, way higher, if it was, say, like 4 point something, they would say it's normal. Well, when I look at blood work, I look at optimal levels. And for me, an optimal level of TSH is 1.8. So they are just comparing you when you go to the lab to sick people who have gone in there and gotten their blood work done. So lab range is just average people from about the last year who have been into that lab, and you're compared to sick people. So when I work with clients, I get a full thyroid panel, including the antibodies, and then I analyze it, and I actually get comprehensive blood work. So I'm not just looking at thyroid hormones. Typically, I'm looking at a lot of different things because I look at patterns. I can see if someone is trending towards a certain disease before any other practitioner would typically know it who didn't do functional medicine. So make sure you're getting a full thyroid panel, which includes TSH, total T4, total T3, free T4, T3 free, T3 uptake and reverse T3, and the thyroid antibodies. Most people, there are about 20 million people in the United States who have hypothyroidism, and approximately 90% of them have hashimotos, which is an autoimmune condition. So you have to look beyond just looking at TSH levels and detect if it's an autoimmune condition, because if it is, that's getting to the root cause of the problem, closer to the root cause of the problem. And you have to then dig deeper and figure out why your immune system is overreacting, why it is attacking the thyroid gland. And that is really the key to figuring out thyroid issues. It's knowing how to look at thyroid function using all of the blood work, a full thyroid panel, and then getting to the root cause of the problem. And the root cause of Hashimoto's can be many different things. leaky gut, liver toxicity, adrenal issues, hormone issues, issues with heavy metals. It could be infections. I think hidden infections. I think this is the number one cause of why people still have thyroid issues after doing everything to change their diet, their lifestyle, taking supplements, whatever. Some people really research and get into it, read different books, and they still can't figure it out. They go to different doctors, even functional medicine practitioners and naturopaths. I hear a lot of this. They still have problems. And they are skeptical because they don't think that after doing all of that, I can offer anything different. And I will tell you that they didn't get to the root cause of the problem. If you're still watching this, talking to me, have done everything, whoever you have seen didn't figure out the root cause. Because if they did, then they should have told you how to fix whatever it was. So you have to figure all of that out. And whatever it would be, if you have toxicity issues or whatever, just figure it out. But I'm going to tell you that you probably need to find someone who's really skilled at looking at hidden infections and detecting hidden infections. And I can tell you that I am, because my undergraduate degree is in microbiology. I know more about viruses, bacteria, pathogens than anyone would want to know. So if you are still having problems, you probably should contact me, because I could set you in the right direction there. And the last thing that I wanted to know want to tell you today is that thyroid medications don't do anything to get to the root cause of the problem. So if you take a thyroid medication, it is likely that you will have to increase the dose many times, change thyroid meds many times, and you're going to keep getting worse and worse and worse and worse. And the reason is that the thyroid medication doesn't do anything to actually solve the problem. That's the traditional medical model. The only answer they have is prescription medication. However, figuring out why your thyroid isn't working, most likely because you have Hashimotos, and what's causing that? Is it a virus that has attacked your thyroid gland and you don't know? The medication's not going to be able to fix that. So you have to work with someone who really, really knows and can figure out these things to help get you back on track. And for a short period of time, I still have some free 30-minute thyroid strategy calls that I am offering. I don't think they're going to last that much longer because I am running out of time and I need to devote my time to my clients. But while I'm still offering these free calls, take advantage of it and get on the phone with me, and I can help to put a plan together for you to help you reverse your thyroid condition. So if you have any questions, leave them in the comments. I will get back to you. And then if you'd like to speak with me, just click on the link to my calendar, schedule a time. Talk to you soon.